Yeah, I mean, I attended one of your courses with the Invisalign, right? And I thought what was interesting is you spent a lot of time talking about all the things that can go wrong, right? Because I think a lot of courses say, look how great these cases are. It's very easy. You drill here, you do this, and everything is great. And I think in some respects, it sets the wrong sort of impression because yes, if you're experienced, if you've been doing this for 20 years, then most cases go very simple for you. But when you're new, your chance that there might be a mistake is higher. You don't know which cases to select and which ones to stay away from. So I thought it was interesting that you spent a lot of time talking about here's all the types of patients you want to say no to because you don't have the skill level at this point to actually deal with this case correctly. You're setting yourself up for disaster. Or here's all the things where, the simulation showed it's going to end up like this. And then you look at the patient 3 months later and it's like, that doesn't look anything like what the simulation software said. How do you deal with that? How do you talk to patients about that? And it kind of shocked me that this isn't really part of most courses. It's in and out. Here's how great it is when everything works out just right. And luckily, hopefully, fingers crossed that's what happens. But if it doesn't, you're on your own. Like you figure, you're not going to call the course professor and say, hey, you told me this would be simple. This is what I'm dealing with. What do I do now? They're not there to help you, right? There is no mentorship. There is no sort of like, let us do it together. Let us do it with me doing it and you watching. Let me, you're doing it and I'm watching and correcting you. And then even once you feel you're ready, it's like, I'll still be there to kind of monitor and be there to help you if something goes wrong, hypothetically. Okay. So is that kind of what motivated? I know you run 4 practices. You've got a lot of associates that you train. Is that what sort of motivated you to start high-tech dental seminars to give people much more practical experience?
Exactly, Nick. Thank you for mentioning that because I think one of the main issues that stops many dentists of maybe doing clear aligners or doing Invisaligns in their offices is the fear of being failed. Right? It's simple because it is there. Failure is there if you don't do steps right. If you are not in a course where you simulate the real experience right. You will fail definitely if you don't know how to select the patient. You will fail definitely. And I have like many dentists coming to me and saying, okay, so if I place implant, but I want to practice and place an immediate implant. I want to extract the tooth and place my implant. I said, okay, but there are more behind it. You need to get the real experience of placing implant to know how to feel the tissue, the bone. And it takes you between, we say the number 50 is the ideal number. Same goes with the clear aligners. Many, like when I went to for example, clear aligner course for the first time in 2014, it was Invisalign, provided by Invisalign. And it was a course for 1 hour or an hour, 30 minutes. And
wow. Okay.
You go and you practice Invisalign, you take impressions, and then you let those technicians to send you these softwares where it shows you, oh wow, this is the patient before and after. That's it. I'm the greatest. That's it. So when you go in that field and you see the result is not there. Like what's going on?
It doesn't always turn out how the simulation shows, right?
No, exactly. Yeah. And
can you call the technicians and like get them to speak to the patient afterwards? It's like, why don't you guys deal with this now? Because you promised me this.
You promised me. This is the picture. Like they send you the video, and it looks, oh wow, it's fantastic. So the problem is like that. I told you, like my passion was always cosmetic dentistry, right? So when I was placing implants, I found that there were lots of congenital missing laterals, these class 2s and malocclusion, where when you look at them, okay, I'll place implants, the whole thing is not looking right. I need to do some changes before I proceed to place my implant. So that's why I did this mini residency in orthodontic for 2 years. And then there it clicked, okay, now things make sense. I have to control that technician. I will never rely on any great videos they're sending to me because I need to place my treatment plan. I need to control the game. And they are there to follow my instructions. I'm not there to follow their instructions. And typically, You will never learn how to do clear aligners in 2, 3, 7 hours. It's impossible. It's just impossible to do.
You need
that.
more practical experience. Yeah, I agree. Because there was a marketplace investigation done by CBC with Invisalign. In most cases, I mean, they turn out great, right? Like my wife had Invisalign done. She loved it. It was fantastic. Everything worked out great. But like you mentioned, it's like 95% of cases turn out great. But there's those 5% that can make or break your business because, they could turn into absolute disasters. And in that course, you had showed an example where it's like the simulation software is saying that this is the plan, this is how we're going to shift the patient's teeth. But you had showed an X-ray showing their throat and how it's like if you're pushing the teeth back,
it will affect their breathing. Yeah,
it'll affect their breathing. But these are things that it doesn't take into account when you're just doing an impression of the mouth and just sending in a scan to Invisalign, for their system. The responsibility as a dentist is on you to look at the entire big picture and understand, like, does this actually make sense for them? And this is what the CBC was highlighting as well when they were interviewing the one of the orthodontic trainers at the university. They said, you can't just treat a patient by just sending in some impressions and, you need to look at this person. You need to understand their health history. The investigation was a criticism against Smile Direct Club, where, yes, most people who send in their impressions, they're going to get their trays. Everything's going to be okay. But there was one patient in particular that they were investigating where after wearing the trays for a couple months, his teeth started to crack and some of them fell out.
True.
Right. So, this can happen as well, potentially with Invisalign. If you're not, like, as a dentist, you're just approving the plan without really understanding what you're approving. Right. It's like, it's like, oh, looks right. I mean, I don't know. I'm sure it'll be okay. It's like, but no, as the dentist, it's your responsibility to take care of that patient. Right. So if something goes wrong, it does kind of fall on you. And I don't believe Invisalign is going to swoop in and deal with the problem. It's like you approved it. You as the dentist signed off that this was okay. We gave you a suggestion. I thought it was interesting. I did interview another dentist that we work with, and he mentioned he did take an Invisalign course, and it was exactly what you mentioned. It was very quick. It wasn't done by Invisalign, it was done by another company, but it was a lot of online videos. And he said by the end of it, it's like, I really don't feel that confident to offer this because if something goes wrong, I really don't have any idea what to do. Or if the plan they're giving me actually does make sense, or if I'm trusting it in sort of blind faith.